Good morning, everyone. Good morning, colleagues. Good morning, ladies and gentlemen. It is with great pleasure that I welcome all of you here today and declare open the 144th session of this Executive Board.
The Executive Board of WHO meet 2 times a year. They're comprised of 34 member country nominations, experts on health issues, and their job is to help WHO to implement the policies from the World Health Assembly. The World Health Assembly happens every May. So this is a really important group of experts driving forward the WHO agenda. ICN, because we have a special status with WHO, we have the opportunity to intervene on some of the agenda items. What does that mean? That means that we can speak on behalf of nurses and nursing on the issues which are of particular importance to us. We have just a few hundred words and a few minutes to make our point. Thank you, Madam President, for the opportunity to speak on behalf of the International Council of Nurses and over 20 million nurses worldwide. But we do so in front of the WHO Director General, the leaders of WHO, and the global health leaders as well. When ICN says that we are the global voice of nursing, this is one very practical way in which we deliver on that. In 2020, there is a unique opportunity to honour the nursing contribution to the health of our world by celebrating the bicentenary of the birth of Florence Nightingale. And ICN fully support the request from Jamaica that 2020 should be the year of the nurse.
Chair and also all member states, if the 2020 could be endorsed as the year of nursing. As you know, the role of nurses is very, very important to achieve universal health coverage.
We talk specifically about the importance of supporting and investing in nurses, but also to highlight the fantastic developments and innovations that we see in nursing care and nursing practice, and how nurses right around the world are critical to improving health and health care.
Greetings, my name is Franklin Schaefer and I'm the President and CEO of ICN-International. We're the world's largest credentialing organization. I'm here today as part of the ICN delegation here at the World Health Executive Board. ICN can and does affect health policy around the world. You as nurses would be very proud to see how nursing is represented here today at the World Health Organization and the Executive Board. Because what they're doing is they're laying the groundwork now for what will take place later this year at the World Health Assembly.
Hi, my name's Debra Thompson. I'm the Chief Nursing and Midwifery Officer from Australia, and I'm here at the Executive Board in the position of Australia's representative, and we also hold the role of Vice President of the Executive Board. It's really great to have support of nursing colleagues as I undertake this work, and wonderful to hear when ICN makes interventions, putting forward that voice of nursing and ensuring that the views and opinions of nurses are always heard.
My name is Carrie McCarthy. I work in the Health Workforce Department here at WHO. I'm the Nursing and Midwifery focal point in the Health Workforce Department. We're really excited because the EB is going on right now, the WHO Executive Board. There are some really important nursing and midwifery as well as human resources for health issues going on. We have an agenda item 6.3, which will give an update on the global strategy for human resources for health, which has a large component which applies to nurses and midwives, as well as a separate strategy, the Global Strategic Directions for Nursing and Midwifery. We'll do a progress report on that as well. So that's really exciting. We're excited that ICN is here. They think they have a really important role representing the voice of nurses worldwide and giving interventions here. They're one of our most important strategic partners in advancing nursing midwifery towards UHC and the Sustainable Development Goals. I think their role with the associations is part of a crucial element for delivering PHC and universal health care, so really valued partners. They're also our co-chairs for the State of the World's Nursing Report, which will be the first ever report to give a description of the global nursing workforce, as well as highlight these really important policy issues that countries need data and evidence to make decisions with in order to maximize the contributions of nurses and midwives towards primary health care and universal health coverage. So we look forward to continued collaboration with ICN.
Hello, I am Fran Moir. I am the midwifery officer at the WHO headquarters. I have been here just over 6 years after about 30 years international work, and I have to say working with ICN and being here is really exciting times. And to be here at a time when the executive board is going on, big decisions are being made about nursing and midwifery is fabulous. Things have changed dramatically since the DG arrived and appointed Elizabeth Ero as the chief nurse, and I'm delighted to say I work 50% with her on both nursing and midwifery. Specifically on midwifery, this year is extremely important, and for the World Health Assembly we will have a special report on midwifery about how we can really strengthen the fundamentals of education and care, and of course that requires partnership with all those who provide elements of midwifery care, especially midwives and nurses. So it's great to have ICN here in Geneva with us. It's great that everyone gets together, and I look forward to working in partnership with you all in future. Thanks.